Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And last edition, I talked about a study that I dug up called A Review of the Application of Myofascial Release Therapy in the Treatment of Diseases. And I came across this study because I was preparing for some work with a couple of occupational therapists that specialize in post-breast cancer work, and they wanted to work with me to hone their myofascial skills because they are seeing the results from what they're already doing and want to get even better, refine their skills. So I am super excited to work with these women and combine our superpowers in order to help more people. So I found this study in the process of looking for articles that would help me help them. And the article that I'm referring to talks about, it was out of China, and they gathered articles from all around the world, 97 articles, and then talked about the application of myofascial release and how they defined it to many different diagnoses, from headaches, back pain, fibromyalgia, breast cancer, brain injury, all kinds of different diagnoses. So what I did next was I looked for all the articles that they referenced in that article and tried to drill down a little more to understand exactly, as much as I could, how they were applying myofascial release and the specific results that they were getting. And I will share these with the women that I'm working with, but I thought I will share them with you all as well. So hopefully you're interested, and this will help you. Many of the articles that I found, I could not find the full text. So some of them I'm just sharing the results of the abstract. But if you hear something that you want to learn more about, then you can drill down deeper if you have access to those articles. I'm hoping that since we are taking a student again, that the university will give us access to the library. I know they used to do that, but I will be inquiring so that I can drill down even farther on some of these. So the first article that I want to cover is, I did get the full text to this one, thank goodness, because because I had questions, and hopefully you will have the similar ones, and I will be able to help you answer them. So the first article is a 2023 article by Kim, Park, and Lee, and it's called The Effect of Myofascial Release in Patients with Breast Cancer-Related Lymphedema, a crossover randomized controlled trial, and this article was published in the European Journal of Physical and Rehabilitation Medicine in 2023, as I said. So the aim of their study was to compare the effects of myofascial release on upper extremity volume in patients with breast cancer-related lymphedema, or BCRL, is the acronym that they use. So this is an outpatient rehabilitation setting, and they had 30 patients involved in this. Okay, so they had 15 subjects received MFR, or myofascial release, for 4 weeks, followed by 4 weeks of a washout period. And that was my first question, was what is a washout period? So if we go down to the washout period, okay, a 4-week washout period was determined by a previous study that they looked at. I did not go back to find that one. Since the study was conducted on active patients, an untreated washout period is not ethical. So they provided manual lymphatic drainage and strengthening for the lower extremities during the washout period time, so the patients were at least getting some type of treatment. Then the other 15 subjects received interventions in the reverse order. So they get the washout period first and then the 4 weeks of MFR. Okay, each session had a 60-minute process, including either MFR or placebo MFR for 30 minutes, followed by complete decongestive therapy for 30 minutes twice per week. So the next question I had was, well, how are they defining MFR and how are they defining placebo MFR? So myofascial release, here's how they described it. MFR was performed by extending the myofascia with one hand or finger fixed to the starting point of the muscle and the opposite hand or finger in the direction of the muscle and fascia by gliding both hands or fingers away from each other in the middle of the fascia. Applied to the sites according to the severity of the fascial adhesions for 30 minutes by pressing and focusing the pressure on the adhesion point of the fascia with the therapist's hand or finger in the direction of the fascia until the therapist felt that the tension was fully released. Then placebo myofascia was they stimulated only the skin surface with light pressure, which did not reach the fascial layer. Their words. Okay, so let's go back to the results then. They said there were significant difference in upper limb volume after both MFR and placebo MFR. MFR-based treatment also achieved a greater improvement than placebo-based treatment in subjective pain and shoulder range of motion, with the exception of internal rotation. So their conclusions that MFR-based treatment is considered an important part of BCRL rehabilitation. And moreover, they say MFR-based treatment may be safe for these patients. Well, that is good, yes. So let's see, another statement they make in here. MFR-based treatment showed clinical improvements in shoulder function, decreased edema volume and pain, improved range of motion and chest mobility. And they suggest, of course, further study in this area. So there you go. There's the first one that they are suggesting that it can be helpful, and they also provide some parameters in the length of treatment and what they did during that treatment, and that they did it for 4 weeks. So they talk about that. That's nice that they give us all that in the study. They don't always do that. So the next study that I found is by Rao, R-A-O, and Patanchetti, and this is a 2022 article. Effect of myofascial release, stretching and strengthening on upper torso posture, spinal curvatures, range of motion, strength, shoulder pain, and disability, and quality of life in breast cancer survivors. And this was published in Physiotherapy Research International, as I said, in 2022. I do not have full text on this one, so this is one you might want to drill down on. The background and purpose. Breast cancer survivors are known to develop upper torso pain and stiffness, including shoulder elevation and ipsilateral inclination of the trunk within a short period of time as a result of cancer adjunctive therapies correlating with the type and site of surgery. So they had 22 breast cancer survivors in a tertiary hospital, and this is in Belgium. Let's see. The pre-post experimental study included myofascial release, stretching, strengthening for 4 sessions per week for 3 weeks for a total of 12 sessions. They were assessed at baseline and post-intervention using a long list of things here: photogrammetry for posture and shoulder range of motion, flexicurve, not sure what that is, for spinal curvatures, digital inclinometer for cervical range of motion, manual muscle testing, and hand dynamometry for strength of the upper back shoulder muscles and hand grip. They also did the shoulder pain and disability index, and they also did the functional assessment of cancer therapy breast for quality of life. So here's the results that they provided. The results of the study demonstrated a substantial improvement in posture alignment, shoulder and cervical range of motion, upper back and shoulder muscle hand grip strength. Discussion. Let's see. Upper torso malalignment and muscular imbalance is seen in patients who have undergone surgeries involving chest wall, and early physiotherapy intervention can benefit the patient's overall physical performance and quality of life. Hence, MFR stretching and strengthening has shown to be beneficial in improving upper torso malalignment in breast cancer survivors. Then they also included a bullet of implication of physiotherapy practice. The suggested techniques can be applied at a larger scale, which involve patients with head and neck cancer, since the areas of intervention are identical. So this one also gives you a lot of information about what they did, and I would guess if they included this much in the abstract that this might be a worthy article of digging up to drill down even further to learn more exactly what they did to get these outcomes. The next article is by de Groff and a lot of other researchers. We'll just say et al. Here. This is a 2017 article, The Effect of Myofascial Techniques for the Treatment of Upper Limb Dysfunction in Breast Cancer Survivors, a randomized controlled trial. And this is a long journal article, or journal title, Supportive Care in Cancer, official journal of the Multinational Association of Supportive Care in Cancer. Didn't know that one existed until now. So again, 2017. Their purpose, and this one I have only the abstract. Besides pain, myofascial dysfunctions may contribute to the presence of upper limb impairments, such as impaired range of motion. The aim of the study was to investigate the effect of myofascial therapy in addition to a standard physical therapy program for the treatment of upper limb dysfunction in breast cancer survivors. They had 50 women who were treated for unilateral breast cancer pain and myofascial dysfunction. The intervention group received 12 sessions of myofascial therapy consisting of release techniques on myofascial trigger points and adhesions, in addition to a standard physical therapy program for 3 months. And this is one you'll have to drill down on to see if they define what standard physical therapy is from their perspective. The control group in this study received 12 sessions of a placebo intervention in addition to the same standard physical therapy. So they did a placebo myofascial, but gave them the same standard physical therapy program. So the results: no differences between groups were found for all outcome parameters over the course of 1 year. However, overall beneficial effects of standard physical therapy program for active shoulder range of motion and shoulder function were found in both groups 1 year follow-up. So their conclusion is myofascial therapy has no additional beneficial effect for improvement of upper limb function in breast cancer survivors. Okay, so here's one that says, nope. But we would want to drill down and find out exactly what they were doing and what their placebo, because I couldn't drill down to see exactly how they're defining myofascial release in this particular study. Now, here's the interesting thing, is this same group of researchers produced another article, and that was in 2018, the effects of myofascial techniques for treatment of persistent arm pain. So now they're looking at pain as opposed to improvement of upper limb function. Okay, let's see. Effective myofascial release techniques for treatment of persistent arm pain after breast cancer treatment, randomized controlled trials, and this is in the journal Clinical Rehabilitation. And I do not have the full text on this one either. So their objective was to investigate the effect of myofascial therapy in addition to standard physical therapy program for the treatment of persistent arm pain after finishing breast cancer treatment. So this is a double-blinded, randomized controlled trial, and this was in Belgium. They had 50 patients with persistent arm pain and myofascial dysfunction after their breast cancer treatment. The intervention, over 3 months, all patients received a standard physical therapy program. The intervention group received additional 12 sessions of myofascial therapy, and the control group received 12 sessions of placebo therapy. And again, I don't have how they defined those two interventions. The main measurements they used, the main outcome parameters were pain intensity, using a visual analog scale, and the McGill Pain Questionnaire. And the measurements were taken before and after the intervention at long-term 6 and 12-month follow-up. And here's the results. Patients in the intervention group had a significantly greater decrease in pain intensity compared to the control group. After intervention, 44% versus 64% of the patients still experienced pain in the intervention and control group. Here's their conclusion. Myofascial therapy is an effective physical therapy modality to decrease pain intensity at the arm in breast cancer survivors after 3 months, but no other benefits at that time were found. There were no long-term effects at 12 months either. And I was happy to see that it was able to help these people in a significant way. No long-term effects after 12 months either. Now, again, I didn't say that. I feel like I've said this a lot in the podcasts that I do. But there's a whole lot of other variables that need to be considered, I think, in these studies, because the women, the people coming into these studies are people coming into that have breast cancer, and they're not just coming in. They're not simply that diagnosis. There's going to be, if they had the people that came into this study, if they were all people who had desk jobs their whole lives, that's going to be way different from if a whole bunch of people came in who were yoga teachers, and that's probably not going to happen. I mean, I recognize there's a massive difference there, but that it's going to be a mix of people. But what's happening post follow-up too? Are they teaching people self-treatment? Are they recommending that if the pain sneaks up on them again, are they going to go back and get some more treatment? I wish I had the full text and I could read a little bit more, but I'm guessing even if I did, those types of things I wouldn't get an answer for those types of things. So anyway, I'm wondering if because it helped them in that first section, there was a good outcome, if they continued it. And we don't necessarily want people to have to continue. Our goal in my practice is to teach them the self-treatment so that they can continue treating themselves and don't become reliant on us, but we are here if they need us. Okay, I've got two more. So hang on. Reading these to you is probably not that exciting, but if you're into working with this population, hopefully this is really interesting to you. So the next study is a 2019 study. Oh, here we go. We're going to talk about self-treatment, effectiveness of therapeutic inflatable ball self-exercises for improving shoulder function and quality of life in breast cancer survivors after sentinel lymph node dissection. And this is also in the Supportive Care in Cancer, official journal of Multinational Association of Supportive Care in Cancer. Again, 2019. So their purpose of their study was to explore the effectiveness of therapeutic inflatable ball self-exercise for improving shoulder function and quality of life in breast cancer survivors following breast cancer surgery. They had 72, so that's a pretty decent number. Two groups, conventional self-exercise group, so they just did the regular stuff that we might give out, and then the therapeutic inflatable ball self-exercise. Now again, I do not have the drill down, and I would love to have the drill down or the full text on this so I could see exactly how they taught them to use these balls, but in many cases, when you're using an inflatable ball, that this is something really gentle. So I think that's probably the most important thing to think about when you think about the results of this study. Okay, so both groups performed intervention for 12 weeks, 3 times per week, 15 minutes a day at least. Interesting. Measurement was performed 3 times for shoulder range of motion, hand grip strength, shoulder pain disability index, and the functional assessment of cancer therapy -breast. So I'm going to skip down to their conclusion. Their conclusion is that IBE, or the inflatable ball exercise, would be more appropriate to start the rehabilitation for breast cancer survivors, and the CSE, or the conventional exercises, would be effective after the pain has improved. So interesting. So this would definitely be one. I'm going to give this one to our student and see if she can find it through the library. And maybe if I find something interesting, there will be a future podcast about it. I will share. Okay, so the final one I have is a 2023 article, Impact of Unilateral Mastectomy on Body Posture. Okay, so this one isn't about myofascial release, but I'm throwing it in there because I think the fascia has such a it creates our posture. It creates our posture. The Impact of Unilateral Mastectomy on Body Posture, a prospective longitudinal observational study. And this was in the Asian Pacific Journal of Oncology Nursing. Interesting. Okay, so the objective unilateral mastectomy is known to induce postural alterations, yet the temporal development pattern of these changes remains elusive. This study aimed to explore the impact of unilateral mastectomy on body posture. And, if you work with these people, I see a lot of these people way after their treatment and, when their standard therapy is over, and all sorts of posture issues. Okay, so there are methods, a prospective longitudinal observational study with one group, repeated measures design. Let's see, this was in Western China, monitored for 12 months post-surgery. A trained nurse assessed 7 postural baseline parameters, on the day of suture removal and at 3, 6, and 12 months after a unilateral mastectomy. 2 parameters in the sagittal plane, head forward posture and trunk rotation angle, and 5 in the coronal plane, neck tilt, shoulder asymmetry, scapular asymmetry relative to spine, and pelvic tilt. They had, in their final study, they had 159 people. Interesting. Okay, I'm going to skip to their conclusions. Postural changes are common post-unilateral mastectomy, with prevalence and deviation increasing gradually, particularly between 3 and 6 months post-mastectomy. Early rehabilitation initiation is recommended to mitigate postural changes. And again, this is happening in the fascia. There's so much fascia in the chest area. This has to be something. And they are very specifically saying that they're seeing it most in the 3 to 6 months range. So we need to be jumping in there. We need to be bringing them back for a check and education, because when they are first released, they're thinking about, what are my limitations? What should I not be doing so that I don't hurt myself, so that I don't cause a problem, so I don't have more pain? And then they probably are forgetting, if anything, that they've been taught about posture, what to do next, if they were taught anything at all. So please learn something about posture. I mean, this was, excuse me, this is one that you can find the full text on this, and they do show what they measured, and it's an interesting article. So anyway, I will send out this information in a future newsletter, so be sure to sign up for the newsletter if you go to Fascia-Informed.com and get on that. You will be able to get these, and then eventually they will get put up on our course library as well. I am still learning in my podcasting journey about show notes and all that kind of stuff, so we'll eventually get there. I'm still trying to run a practice as well, so this is the best I can offer you for now. So thank you so much for listening. I appreciate it very, very much, more than you know. Thank you so much. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.